Should we eat brown rice? Should we be concerned about reports that it may not be the right thing to do?
I'm not eating brown rice right now because there's so many other grains I can eat in place of brown rice. Um, brown rice is the one grain that has increased arsenic content in it. The hull of the brown rice attracts arsenic more than other foods do. And arsenic is a carcinogen. It's a dangerous substance, even in small amounts. And most of the places that grow brown rice obviously either have soils that are somewhat arsenic containing, toxic, maybe old cotton fields where they used some type of pesticides that were arsenic containing, or they're dumping chicken manure that has arsenic containing substances they fed the chickens. But because of that, the brown rice supply is relatively contaminated. Now, if you want to have some brown rice and you soaked it overnight, let's say, you soaked it all night long, and then you poured out the water and you cooked it in water for like 5 or 10 minutes, cooked it for water in 5 or 10 minutes, and rinsed it off and poured out that water, and then cooked it again in fresh water. So if you cooked it twice, once soaking it, pour off the water, then cooking it for a short period of time, 5 minutes, 10 minutes, and then pouring off the water, and then putting new water in and cooking it, and then making it brown rice and having it a few times a week, probably okay. You took out most of the arsenic. But for me, I'm not going to go through all that bother of trying to get the arsenic out of the rice, because I like quinoa and kamut and teft and all these other grains that are fine. And then you can have, kombucha squash and all types of incredibly delicious, rutabaga, all types of things. You don't have to have brown rice, But I would, if I was having brown rice once in a while, I wouldn't fret about it, but not going to recommend people have rice-based diets, especially the old-style macrobiotic diets, eating mostly brown rice. The answer to the question is yes. I think people should avoid brown rice and be careful, and if they do want to eat some, prepare it in a way to minimize the arsenic exposure. And I do sometimes use some brown rice that I purchase at like an Indian reservation that cultivates it on marshes, not wild rice that's commercially cultivated, but wild rice that's collected wild from, and even a little bit of that probably has less arsenic in it. So the answer is, again, remember we talked earlier about nutritional variety in your diet, not making your diet centered around any one food? Well, you know what? The flax seeds could have too much cadmium in them too, and the kale could, but the fact is we're not just taking one farm, one part of the country, one food, eating a lot of it. We're trying to eat a lot of different foods from different parts of the world and different types of foods, and we're keeping our exposure to any one toxin too high. And of course, things we know that are particularly toxic, especially we're not eating inorganic soy or grains that are contaminated with glyphosate or anything, So we're trying to eat organic and trying to have variety and trying to avoid brown rice, all those things to keep our diet, and also seafood too. I used to think that a little bit of seafood is probably okay, like, especially smaller seafood like sardines and what are those things called? Scallops, things like that, smaller seafood, because it's the bigger seafood like shark and tuna and swordfish that collect the lead and the other toxic metals because these are predatory fish, eat smaller fish. But now we know we're dumping 1,000 tons of plastics into the ocean every hour. And these plastics break down into microplastic particles that are ingested and inhaled and eaten by fish and get into the fish tissues, their muscle tissues. So when you're eating any kind of fish, you're getting microplastic into your body, which is probably a carcinogen and hormone deregulator as well. So it makes more sense to be to move your diet and not to think that fish can be healthy, where even in small amounts. So we're looking to be more careful with our exposure to toxins. And having organic plants is probably our cleanest foods we can get.
Should we take the supplement DHA? Can we instead get it from food? Has it been negatively linked to prostate health?
Yeah, there's another fallacies going around about that. I think in the vegan community, there's such a strong desire to teach that a vegan diet is so ideal and perfect that it has no flaws. And that can get people into trouble, because that automatically places you at some kind of bias to try to look for reasons to justify your behaviors or your preferred way of eating the same thing that people that prefer meat do. And I'm trying to be more cautious here to make sure we don't make mistakes with people. And I think I'm the only physician in America. I'm certainly one of the most experienced dealing with long-term vegan population, who actually is a primary care physician who took care of vegan populations from the 1950s. I got into this stuff. We're talking about some of the early vegans in this country with American Vegan Society, and the American Natural Hygiene Society started in the 1950s. Some of these people were my mentors, and I learned from when I was, in my teens and even in my childhood, in my 15 years old, and going to. But a lot of these people who were elders and my mentors in the field of doctors at that point, who I looked up to, I had to take care of these people. As I became a physician, they became elderly, and a lot of these people who were older than me became my patients, and I cared for a huge amount of people in that community, seeing that a lot of them, or most of them, developed neurologic deficits when they got older. A lot of them developed Parkinson's disease and also some degree of dementia. Certainly they lived a long time. They didn't get cancer and heart disease. They had a good lifespan. But because you have better lifespan, makes it more important to do everything right. So if you are living, you have your full mental faculties at that point when you're living after the age of 90, let's say, right? And we're talking here about Dr. Shelton and Dr. Vetrano and Dr. Sidwa, and I could keep going names of people. I'm not going to, I can mention those names because they're well-known people that have passed away, but I think that we're talking here about the fact that as a physician, my suspicions were well, why am I advocating this way of eating if all these people are developing problems with it? And I have to be able to delve into and see where the problems are lying and why they're getting these problems. And doing blood tests on these elderly people who were developing dementia and brain shrinkage, showing that they had very low, extremely low DHA levels. And then, obviously, that clinical information is corroborated by studies, and I have to say this carefully, every study that looks at the omega-3 index and tracks the level of DHA exposure as people age shows that lower numbers exposed to for many years, for decades, is associated and linked to brain shrinkage, smaller brains, and cognitive impairment. We can't deny the reality that lower levels of DHA exposure and omega-3 index is linked to cognitive impairment and brain shrinkage with aging. And of course, my experience as the only doctor really caring for large numbers of these vegan people, we're talking about, that I became the physician of choice for at least this vegan population for many, many years. And this vegan movement is very new in this society, in the United States, right? There haven't been a lot of elderly vegans being studied heavily, And of course, then people give the argument, well, there's more dementia among meat eaters, there's more dementia, vegans have less dementia. That's completely irrelevant. It just shows their desire to twist to talk about. It's irrelevant, the fact that SAD eaters get a lot of dementia because they're SAD eating, and that DHA deficiency is not the only cause of dementia. Of course, the major cause of dementia is atherosclerosis and exposure to other toxins and other chemicals. And of course, eating meats and eating all the other way people eat is more dementia causing than eating a plant-based diet that's not DHA deficient. But DHA deficiency among vegans is a cause of dementia among vegans. Among people who are not meat eaters, obviously, they're going to have a higher risk because they have other causes of dementia and maybe not DHA deficiency. And fortunately, we can do blood tests to see if you're one of those people whose omega-3 index is particularly low, where you require DHA supplementation or not, if you don't want to take it. There's no controversy here. People bring this up like a controversy. There's no controversy. It's clear. If you think that your diet is okay when you're having enough exposure to DHA, then draw a blood test and see if you're right. If your level is really low, then you're wrong. Nobody could say with scientific authority that having a low level associated with brain shrinkage and dementia is good to maintain just because you're a vegan. That's just stupid, But anyway, the point is, yes, some people can convert, especially if their diet is really careful. They can convert enough of the short-chain ALA into EPA and DHA. And maybe their omega-3 index is above 5 and they're okay without that. I know a couple of people whose levels, and know some people whose levels are adequate without taking supplements. And that's great. I'm glad they have that genetic ability and their diet's so careful they can do that. But unfortunately, 90% of people don't have levels that are that favorable. And they do require some supplementation to maximize their DHA exposure to keep their index above 5. I came to that, I'm looking at the data. Actually, when I first was in practice 20 years ago, when I was looking at all these elderly people developing problems, especially later life dementia, and low in DHA levels, I'd prescribe a DHA to them, and some people would get burping or indigestion from fish oil or vegan DHA, and it was too old or rancid. So I really wanted to take some effort to make sure they have access to some fresh DHA that's not old, so they can benefit from it. So I think that's an incredibly important contribution I've made to people, to enable them to be able to know about this and not bury every defect in a vegan diet and every potential problem, to sweep it under the rug and to wait till people get in trouble. And then once you have dementia, taking DHA is not going to benefit you. And then you brought up this concept of prostate cancer and DHA, which is also an argument some people may make to try to, or how should you say, promote their prior proclamations. They don't want to admit, but in any case, any substance we take in excess can cause damage, right? We're talking here a nutritive dose, not a pharmacologic dose. They use fish oil pharmacologically to lower triglyceride and cholesterol. For heart patients, doesn't really work. And people are taking high doses, 1, 2, 3 fish oils a day to have that effect. Probably not a good thing to do to take fish oil such in high amount, because high dose fish oils, EPA and DHA, have immunosuppressive effects. I utilize them sometimes because some people with ulcerative colitis, Crohn's disease, are fish oil responsive, because we use fish oil as a drug, not as a nutritive substance, to immunosuppress, to help control their disease process. Probably safer than other drugs we could use. But nobody's saying that a high dose fish oil is needed or beneficial. So you can't look at studies looking at what people are overtaking a substance. High amount of vitamin D could increase risk of cancer too, but that doesn't make it better to be deficient. Let's not take vitamin D, because an excess dose can cause harm. Let's not take selenium. Let's not have any selenium in our diet, because a high excess could be too much, could be bad. You know what I'm saying? Just because too much of something is not good doesn't mean the right amount is unfavorable. And the fact that the data that showed that there was some link between omega-3 intake and omega-3 blood levels and prostate cancer was not a study that should be held in high esteem. Because that study also showed that trans fat was better to have more trans fat than to have low trans fat. The whole study was discombobulated and was showing confusing and inconsistent findings. There are a lot of studies on cancer and prostate cancer and fish oil and DHA supplementation and fish exposure, and they're all over the place. Most of them show it's protective against prostate cancer. Most of the studies show that the level in the blood and the intake are protective, because some studies show they're good, bad, indifferent, middling. It's obviously there's no strong effect there. It's just you can pick whatever study you want to make your argument. But we look at all the studies, and that's when you ask a question to somebody. You have to see, well, have they reviewed all the studies on this subject matter? Or are they just picking the one that supports what their viewpoint? Or two, and so the answer is that it takes a lot of time. I've reviewed like 50,000 studies. When I look at certain condition, whether it's, a certain nutritional question that has some controversy, and you look at all the data, it usually points to a good direction of where you should go. But you can use part of the data to really to try to make a different argument. So all the data shows that obviously we're on the most prostate cancer program you could possibly be on. The Nutritarian diet takes it the highest step of anti-cancer dietary portfolios. And as people are aware, even Dr. Ornish's program, which included fish oil, showed prostate cancer was reversible. Reverse their PSAs. In my experience, and I don't include those high amounts in them. I would think that somewhat. I'd be more cautious with that and giving people more of a low dose nutritively, not to get such a high dose, but still a Nutritarian diet, which includes so many high cancer foods, particularly raw onion and cooked mushroom and scallions and vegetable juices and all these things we're putting in sprouts and microgreens, all these things we're doing to make the diet so powerfully against cancer. To think that you're not going to take in DHA and flirt with dementia or Parkinson's because you're thinking or afraid that the DHA might cause prostate cancer, that's just insanity and has no scientific basis.